Good morning, everybody, and welcome to this is what, April? The April Disabilities and Conditions of Aging Network. Originally began as just Central Indiana, certainly has grown to include anybody within the state, or even sometimes folks from outside of the state who are with organizations that are working in the state. So we're going to explore some of that. I'm Jeremy Warner. I believe all of you have met me in the past. Walking Spirit is my organization. It is focused on consulting on not just the ADA. I am an ADA trainer, but actually helping places of public accommodation go beyond the starting line of the ADA and actually lead the race in making our world more accessible. So that was the original vision. Walking Spirit has gotten into some other things, including event management, strangely. So I am currently promoting an unconference for people with disabilities that I'm sure you have all heard a little bit about and seen information about. Please feel free to ask questions about it. It will be August 27th through the 31st in Indianapolis at the JW Marriott and is hosted by Everybody Counts, which will be covering hotel rooms, 2 meals per day, and parking, as well as all of the other infrastructure around the conference. The themes are disability history, culture, rights, advocacy, and community engagement. And because it is a sponsored event and they're covering the costs for the attendees, we are doing an application and interview process. Hopefully, we'll be doing interviews within the next month and a half, 2 months, and getting decisions to people by the end of July, or by the beginning of July, rather. And and really, anybody who can self-identify as an adult with a disability who lives or works in Indiana, who wants to be a leader in the disability community, the broad disability community statewide, should apply. So anybody who knows folks who meet that description, please encourage them to do so. We want a diverse group of people with disabilities from, again, all across the state. So and diverse disabilities, not just diverse identities, but diverse disabilities within those identities. So that's all that I will share about that right now. Feel free to ask questions, but I don't want to monopolize our time. And we already saw what this network was originally intended to do happen during the chit chat time during the first 5 minutes or so. And I'm thrilled to do that. So with that in mind, I'm going to hand it off. I'm going to ask Beth DeHoff to jump in, introduce herself and what's going on in your part of the community.
Hi, I'm so glad to be able to be here today. I often have a staff meeting at this time, but it was canceled today, so here I am. Um, I work at Riley in the NICU in the Family Support Program. I am also the chair of the Governor's Council for People with Disabilities until the end of September when I roll off and can serve somewhere else. So I would just like to mention a couple of things from both of my worlds. Because I'm a longtime healthcare financing nerd, I keep very close track of legislation. There was some state legislation passed yesterday that was actually good. Um, I know. I mean, mostly I have bad news, but a little piece of good news there is going to be a ombudsman for folks with complex medical conditions. There's going to be some discussion on expanding the definitions of complex medical needs, and all of this will help those, especially with children that have extremely complex medical needs. So there, I have more information on that, and you'll find more on that at the Preserving Parent Caregiving Facebook page as well. But it doesn't solve all the problems, but it is a legislative commitment to consider the problems and find solutions. So does it change the world? No, but it's a good positive step. The other side of that coin is there's a significant budget impact on Indiana this year of over $2 billion that they want to save. And so that is always concerning. Um, there's a huge concern right now about HIP, which is for adults, Healthy Indiana Plan 2.0. Um, the state budget is looking to curtail that quite a bit um, by doing quarterly redeterminations. And there is also a threat to the Medicaid budget federally. There is a trigger law in Indiana that it's a federal contribution of 90% of the cost of the Medicaid expansion plan, which is HIP. If that federal contribution goes under 90%, we have a trigger law that would allow us to discontinue HIP. So there are concerns about Healthy Indiana Plan. A lot of people who have disabilities who work get HIP. So it does affect our disability world. The other concern is that home and community based waivers are also optional Medicaid dollars that could be vulnerable in this climate. So there are concerns and advocacy opportunities, but there is a little win in the Indiana legislature in the middle of this budget crisis that was super surprising. So I do follow all this stuff because I help people access Medicaid, and our families are struggling because there's a waiting list now for the health and wellness waiver. And there looks to be what could be a significantly increasing waiting list for the beads waivers, and that's not released or certain yet. So there are increasing numbers of people with disabilities and their families who have a gap in coverage, and that's hugely concerning. So that's a little bit about my world. A little good, a little bad, and a lot of uncertainty.
Thank you. Since you're bringing up the gap in coverage, do you, and I don't know enough about this to really speak educated from an educated place, but do you have any thoughts on the Medigap policies that folks are out there trying to get out there, especially for my understanding is younger, um, right now for younger folks who are on Medicare, that there is, I guess it's going to become more expensive if they don't get on it now. Is that real or is that just a sales gimmick?
Um, I don't know much about Medigap, but I think that's Medicare, not Medicaid.
True.
Yes. So Medicare is only available to a certain number of people, especially it's a very limited number of children who are
Yeah.
eligible for Medicare.
Okay.
And I deal with maternal child health. And so if it's not about a mom or a child, I have less certainty about programs for adults.
Very good. And
Other than my mom, I have mom knowledge because I have an adult with disabilities in my family, but otherwise it is a Medicare issue and I'm not as versed in
okay.
it.
Thanks. Well, and thank you for bringing up parents because I did leave out when I mentioned the unconference. We are also considering parents of children with severe disabilities who apply as potential attendees. So
I'm glad to hear that.
yeah, and
A lot of times our individuals with severe disabilities and limited communication skills get left out of these opportunities. And so I'm glad to see that you're thinking about that.
that's yeah, I mean, we are very much wanting to, like I said, have a very diverse group. And I will say that is one thing in regards to helping me get the word out there. Um, Not just getting it out to different specific organizations that work with disabilities, but also getting it out to different cultural groups to make certain
Mm-hmm.
that we are reaching everyone and not just one particular demographic with
Yeah.
disability. So,
Okay.
uh, so thank you. Anything else, Beth, or are we ready to move on? Oh,
I
there's a
think we're
question. Go ahead.
I am an alumni of Partners in Policymaking, the program through the Governor's Council for the Disabilities. I think Beth is probably too.
Well, I'm the chair of the Governor's Council with
Did you go through
people with
Partners?
disabilities, but I was never a partner.
Oh, okay.
Yeah.
So Partners, at least when I was a part of it, it was about 35 people. It was half parents and half adults with disabilities. And that combination, it was amazing and it was absolutely life-changing for me. And then obviously then life-changing for my child. I
Hmm.
was a partner when he was like 3 or 4, and he's almost 13 now. So it's been a while. Um,
It's been a while since we've done our partners in policymaking too.
yes, we weren't the last class, but we were close to it.
Hmm.
Um, and so yeah, me having that experience when he was young has completely changed the trajectory of his life and then obviously of my life and my career. So it is really, if you can get those two groups together and have like the real nuanced conversations that just aren't happening, um, yeah, it's amazing. And partners and people who graduated from partners have completely changed the state here. Yeah.
Yeah, that's awesome. We
Okay.
also have a family network project that there are several members of that network that are family serving organizations, and there's work right now to get those family networks developed and working with um, individuals and families to increase access to disability services for people.
Good. Courtney, do you want to go ahead and just jump in?
I mean, I don't really have anything to add. I'm in grad school now, so I am participating more as mom than in any like official capacity anymore.
Okay. Very good. Well, congratulations on being in grad school.
I don't know if congratulations is the right word this week. It's finals week, but thanks.
Fair enough. Fair enough. Okay. All right then. And also, I see folks are using the chat to add your information. Please do that. Your contact info, any like I've posted the flyer for the unconference and the accessible PDF application. Anything that you guys want to share, please use the chat to do that. Christina Rodriguez, would you like to introduce yourself and talk about your corner of the disability world?
Yes, good morning, everyone. My name is Christina Rodriguez. I'm the outreach coordinator here in Indiana for AbbeyCare. We are paid family caregiving essentially. So we work off of the health and wellness waiver pathways, and most recently we expanded into pediatric PA. So we are going to be training those parents and caregivers of children with disabilities to be home health aides where they can get paid hourly again. And we will be covering all the costs of training and testing for those caregivers and parents, which is really a game changer. A lot of other agencies and stuff you have to pay up front. So we really are thinking about the parents and what they've been going through. And our founder was more than happy to go ahead and take that cost for them. So we'll put them through the training. We also help our families with resources. So if they need connected to like another community partner, they need financial assistance, whether it's rent, food, anything like that, we connect them with those people. If we're able to help and jump in, we'll go ahead and do what we can for the family. We also get them together monthly. We invite all of our families out for coffee and connection, just to come out and chat, get out of the house, connect with others. And of course, it's a completely free event. And we do quarterly events for our families as well. But there, we take them out to like the zoo or making candles or to a park, some kind of connection, maybe a pizza game night. But we're really involved. We choose to serve the underserved. We started out in Colorado. So we're in Indiana and multiple other states as well. But yes, I just wanted to share this space here. I am available for resource fairs, lunch and learns, anything like that. AbbeyCare is very generous again on sponsorships. So if anybody needs any kind of sponsorship or anything like that, feel free to reach out to me. Or if you guys have a family in need, Also, feel free to reach out to me. I put my business card in the chat. So happy to connect or help where I can, even if you have a family that's just in need of a resource. Maybe they don't even need our assistance. I'm still happy to come in and help where I am able. So thank you, Jeremy. I appreciate
Thanks.
you giving me time. Thank you.
My pleasure.
Yeah, thank you so much.
Any questions for Christina?
I just wanted to mention we're really glad to have Abby here in Indiana now. We also have other agencies who provide free home health aid training.
Yeah.
So there, there's lots of things to look into, and we're glad that Abby Care is going to be one of those options. So thanks
Yeah.
very much.
Yes. Thank you so much. Yes.
Yeah, I know specifically the pediatric care has been a struggle to find a home health aid company that is
Yeah.
willing to take on that risk and that liability. So,
Yeah. Yeah. And a lot of people asked us that because we started, as you know, like I just said, we're doing adults and seniors on health and wellness and pathways. Of course, you might have some kiddos on health and wellness, but very few. And essentially everyone on those waivers needs PA now, as we all know. But we decided we wanted to go to pediatric PA first, because that is always been the mission behind Abbey Care is those kiddos and those families and keeping the money in home. And that's what we chose to do. We want these kiddos to get better. We want them off feeding tubes and G tubes. We want them to have the best care possible. And that's why we chose to go into it first is really it's all about the mission. Our founder, she also took care of her disabled sister. So it was just, there's a lot of mission and a lot of us at Abbey Care are really strong about what we do. And so I'm just here to hold space. And like I said, thank you so much for just allowing me to share and gain these other resources and stuff for our families because they need so much.
thank you, Christina. Do you guys also work with folks who are on the, and I hate using the buzzwords or the term, but the beads waivers? Or are you just on the health and wellness and the
Yeah.
pathways?
Yeah, so we're just on health and wellness and pathways. So Abbey Care has been in Indiana just over a year. And our first expansion was PA, pediatrics. So like I said, we'll eventually go into all the OT, PT. Like, I mean, that's what we'll eventually go into. But as of right now, this is what we've chosen to do.
Okay, sounds good.
Are you billing the actual waiver or are you billing traditional Medicaid?
For PA, it's Medicaid, and for the others, the waiver services.
Okay, for PA, those on the beads waivers also have traditional Medicaid.
Yes, so they can utilize, if they would like to utilize their waiver and be a home health aide, they're able to do that as well if that's what they would like to do. They can utilize the services still through those CIH waivers or the family support waiver, and as well become a home health aide. So we're starting them off at 17 an hour for the home health aides. And we're also offering like PTO, 401k. They're basically an Abbey Care employee. So they still get all the benefits as well.
Okay.
And for our health and wellness and pathways, we start off at 17, and we have a $2,000 sign-on bonus for those. And we pay weekly. Again, we offer the benefits, the 401k insurance, and they do even offer PTO.
Okay. Thank you. So yes, as always, like I said, continue to use the chat. Also, though, if anybody is short on time, let me know so that I get to you before you have to go. Otherwise, if nobody is in a rush, then I'm going to call on Sonia Eisenhart to talk about accessibility. And what's going on with you?
So, um, Accessibility is a consumer-led agency that helps individuals that identify as disabled to live more independently. We have four-ish, five-ish independent living advocates. We right now are a very small team, but we're mighty, and we get along so well, and we are very cohesive. We work well as a team. Um, we have support groups that we do Jeremy's got the amputee. I've got financial wellness and connections cafe, which is a new one.
Mhm.
There is a spinal cord injury support group. There is even a Spanish Zumba that meets every Tuesday. So we've kind of got the gambit. We've got someone that uh, helps families with visually impaired individuals. So those are our support groups. All of our services are free. And we have, not that we weren't involved with lobbying and that type of stuff and, keeping an eye on laws that affected us. We've been just launched into it at this point. So, we went to the state house, had a luncheon with the reps, got to talk with them this earlier this month. And almost the whole team went down there. It was wonderful. Got to talk to reps and just let them know what it is that we do and why it's important what we do. Um, and I don't think we have anything new, unless Jeremy, you're nodding your head. What are you nodding your head about?
I
Oh,
don't know if you
okay.
guys have anything new. I mean,
I did. I did. So anyway, um, that is accessibility in a nutshell.
thank you. So because at the beginning of this meeting, I got to witness a really great conversation take place between you and somebody who's never been on here before, and I'm thrilled to have him with us. I'm going to go ahead and call on Matt Holland next so he can talk about CHIP.
Thanks, Jeremy. I am Matt Holland. I am the Senior Coordinated Entry Manager at CHIP, and that's a whole lot of words. And as many of you may know, nonprofits, we love a good title that makes it kind of ambiguous as to what we do. Um, Essentially, I work with one other team member to manage the HUD housing resources that Indianapolis gets for homeless individuals, families. Um, from supportive housing to what you may have heard of rapid rehousing, kind of along the whole gambit. So I am thrilled to be on this meeting and have had the invite for a long time, full disclosure. But Jeremy and I were connected in a previous career field and recently were able to reconnect, and I was just thrilled about it. So this meeting has already paid off, as Jeremy said, because Sonia and I were able to um, connect and start to problem solve some things that she's running into. Um, I will. Thank you for the reminder on the acronyms. That's one of the things that homeless system providers are terrible at, is just assuming everyone knows what acronyms are. Um, so that's the Coalition for Homelessness Intervention and Prevention. And essentially, we convene um, system partners to problem solve um, challenges that tie into housing. Could be ancillary, could be directly tied into housing, but also, as many of you on this call probably know, they overlay with lots of other systems, right? It's all a tangled web of complex challenges in all of the systems we navigate every day. Um, as you guys do, they have been built over time, and the complexity just kind of sometimes makes things much more difficult for folks to access the care that they need. So we're really trying to advocate and get into spaces that maybe we haven't been in the past. And we work with a lot of folks with disabling conditions across the whole board. And so this is really a space that I think, at least from a housing standpoint, we want to continue to explore where opportunities for collaboration are. Um, on that note, there is a bill that our system has been following. It's House Bill 1014, I believe. It's the third attempt now in the session to add language around criminalizing homelessness, which in itself is shameful in the richest country in the world, but is a trend also across many communities. Um, the thinking, and there's some think tanks that are kind of behind this effort in multiple different states. The thinking is that if someone is kind of threatened or has the penalty of being incarcerated, then they will find housing. Well, I wish it was that easy. It's not. So we're just trying to make sure people are aware. The language has been inserted. If you feel so obliged, I'm sure legislatures are willing and open to hearing from the community. It comes right, the third time comes right at the end of the session here. Um, and so we're really advocating to be like, hey, we would love to be part of the conversation, but this whole not talking to people with lived experience and um, expertise in the subject matter really is not terribly helpful. So anyway, that's something going on in our space. And many of the folks that it would directly impact are living unsheltered and have a gamut of disabling conditions, right? We have folks that are unsheltered that have colostomy bags or they're post surgery and they have nowhere to recover and they have to go back into their camp, which good news, bad news is where they feel safe, but also very difficult to heal from a medical standpoint or a mental health standpoint while you're not in your own place. So we're very passionate about that. And it is, as many of you know, it's a concerning time just across social service networks and all of the reality of what's happening at the federal level. But the thing that we keep kind of seeing in the community is that there is just a super strong network of people that are still out there advocating and doing what they can do to connect people to the care that folks need, and that's tremendously inspiring. So, just really grateful to be part of this call. Thank you, Jeremy, for keeping your faith in me. And I already got Sonia. We're going to connect maybe after the call. So,
Very good.
good stuff.
Well, and that was always what the idea was for having this network was to provide a place for anybody who touches the disability community to connect and hopefully support each other's efforts to better support the community that we're all connected to in one way or another. And the longer we live, the more likelihood is that we'll be more connected to it. So, um, all right. So with that in mind, does anybody have any questions for Matt? Yes.
I do. Yeah. Hi, Matt. I work real closely too with Unhoused and
Hmm.
Horizon House and stuff, but have you been to Boots on the Ground networking events? Have you ever
I
heard of that?
I don't think so.
Okay, Boots on the Ground originally started for the unhoused. It's led by Pastor Corey, and it happens on the second Wednesday. And I'm happy to send you an invite. Um,
Okay, great.
Westminster Neighborhood Center. Even if yourself couldn't go, if there's somebody, a representative from CHIP that could go, there's usually about 50 to 60 of us there.
Okay,
From the trustee's office to the police department. There's Eskenazi Weavers, I mean, there's just Firefly.
awesome.
There's like tons of folks there. So even your guys,
Great.
everybody else on the call, if you're ever looking to join, it's just an amazing group of folks, especially those that are helping the underserved, not just the unhoused. But I'm happy to send you an invite if you would like to come to it. Like I said, it's a
Yeah,
free event. We have lunch and we all get together and um, everybody goes around and kind of says what we do, and then we all network. And it's just really, really, it's a good place to be at.
cool. Yeah, that'd be great. Thanks, Christina.
Yeah, I've met so many great people from there. It's really, really nice. So yeah,
Well, that's one of the big benefits, right? Is that this work, including the work that you guys are doing, is so relationship based. Everything is
yeah,
really based in that space. So,
yeah.
um, appreciate you helping to plug us in.
Good.
Yeah. Yeah, I don't know if I see your email in the chat, but if you drop it in, then I can just add you to
Sure.
one of the next invites.
Very cool. Matt dropped his at the very beginning.
Oh, did he? I'm sorry. Okay. Yeah,
That's
I can't
okay.
the
It's in
link.
there again.
which as I'm scrolling through the chat seems to apparently go back to previous chats, which is interesting. So, but yeah, Matt just dropped it in again. So, all right then. I will call on Crystal Hall.
Looking for my mic. Good morning, everybody. I am Crystal Hall. I'm the Regional Director for Epilepsy Foundation, East Operations of the Epilepsy Foundation America. So I literally am the supervisor of chapters over about 10, 11 states on the East part, but I directly work with Indiana and Ohio. I do live in Ohio, don't judge me that I'm not in Indiana, but I do the Epilepsy Foundation Indiana and Epilepsy Foundation Ohio. With the Epilepsy Foundation, we work with people living with epilepsy, the resources, we give them resources and referrals, and we also work with the community, making more aware of what epilepsy is and how to help someone who may have a seizure in front of them. We have advocacy issues that we try to go and help with, whether it's for schools, for students, for IEPs or 504s. I think I shared maybe the last time I was on here that we have seizure safe school legislations that have passed in over about 27 states. Indiana was it was the second state, but last year it got repealed. And so now teachers don't have to be trained in seizure safety for their students because of that repealing. We're still trying to repeal the repeal, but it doesn't seem to be up in the importance of them yet. But we've also gotten it done in other states. We have schools, we have training for students to understand their peers and how to help their peers, because we do know that about 80% of the time they're with their peer when they have a seizure. And so how to understand it and how not to be bullies and things like that. So we do a lot in the community. I did put in the chat that we have a walk coming up um, at Butler University on May 17th. We are looking for people to have tables to just be resource. Last year, it was a wonderful time. It was the first time we've done it like a resource fair community event, and there were a lot of people there to give them like resources in the community that families can use. This year we have a couple so far, and we're still looking for more. So if you are interested in having a table there, to be there or just come out and be a part of it anyway, whether you have a table or not, we would love to have you.
Is there a link or a formal way to reach out if you want to have a table?
Yes, you can reach out to me. I did put the vendor commitment form out there, but you can reach out to me and I can send it to you separately if you need to.
Ah, okay. Yep, I see it. Wonderful. Thank you. Any other questions for Crystal?
I just want to say that last year accessibility was there, and that's how we met Abby Care. And Abby Care came and gave us a lunch and learn. So I learned about it here at this network. That's how we ended up there last year. So it was fun. It rained. It was lovely. We got wet, but hey, it was all good. So I would highly recommend that. And I hope we go again this year ourselves.
Very good.
Sonia, if you need me to send you the form, I've been working on it and you guys have to excuse me. It's been a rough year. I got a promotion, but I also, like in January, my mom's husband got real sick and then he passed in February. So it's been kind of like, and I am a lone soldier pretty much. So um, I'm working on it and sending out stuff. So I've started sending out stuff a couple weeks ago. I know Abby Care will be there again this year. Theraplay will be there as well. And so if you need to, just there's no charge. We just want to be a resource and have other resources out there for people because we do recognize that there are other comorbidities that go along with epilepsy and not just, and so just being a resource there. Matt, if you know somebody, if you can have a table, we do deal with homelessness. People are losing their jobs and they are looking for places. So if anyone else wants to be there.
Thank you very much. Yeah, that is huge. So, and you mentioned Theraplay. I believe that is in Hamilton County, which then automatically leads me to Kristen Ludeker-Siebert from Hamilton County Systems of Care. And I do want to mention, Kristen, before you joined us, before we started the meeting, Crystal was bringing up the fact that epilepsy is one of the few conditions that does not have wraparound services.
Which is correct. Unless it could be covered under the CMHI, so DCS prevention dollars, but I don't know.
Yeah, so we have a national epilepsy plan that we are advocating for that will include wraparound services, but right now there's not one.
Okay.
Yeah.
Yeah, I lived the world of wraparound for, I don't know, 8 years or something like that. I was a facilitator and then I worked for the Division of Mental Health and Addiction. So yeah, I lived that world for a while and then moved over into systems of care. So I like that segue, Jeremy. You're like,
Thanks.
and guess what's in Hamilton County? Guess
Uh-huh.
who else is in Hamilton County?
Yeah. Trying. I'm working on it today.
It was good. It was good. I don't have much to add today, honestly. Everything that Matt Holland said, like I felt in my soul. Um, the whole idea behind a system of care is to have similar to this in that there's a convening location, but it's a higher level look at, in this case, our county and all of the systems that care for people, which is like all of them. But providing a place for the conversations to happen. And I guess you can say our overall topic is mental wellness, but that's kind of the overall topic in general on people just, living a healthy life. So, I actually have nothing really coming up to talk about today. I know, right? I also have 4 grant applications due next week. So that's where my brain is right now. But like I said, with what Matt said about nonprofits and living in this world right now, and it is difficult. We do everything's changing around us. Um, funding expectations, what people want to see. And I've tried to consciously step out of the weeds a little bit to be able to watch where everything is and where it lands, and then what that means for Hamilton County System of Care. Who else do I need to pull in? What else do we need to focus on? What is our next initiative? The biggest initiative that I'm focused on right now continues to be our Veteran Suicide Prevention Coalition. So that's Stronger Veterans, Stronger Communities. I've led that since December of 2021. And we were the first and actually still the only county that it has been funded by IDVA to put suicide prevention plans into effect. So those are things such as identifying, connecting, lethal means safety, those types of things. And I'm prepping right now for year 2. So my brain is like full of things. If there's anything though that anybody works on, or if you intersect with veterans in any way, especially like Matt and homelessness, and I keep talking about Matt and he's new here, but welcome. Um, Unhoused, those types of things, let me know. And we can talk. You can join our coalition, meet other folks working within that veteran serving system. So yeah, that's what we're focused on. Other main things that I'm kind of helping out on, we are preparing to launch a web app called Navigate Hamilton County. It's not up yet, but it will be navigatehc.org. And that is going to be a web app for people in and around Hamilton County in regards to resources. We have talked for years about having as central of a resource repository as we can, and the brains finally came together about a year ago, and we're getting it done. So it took us a while, and it took the right people, and I truly believe that. That's why we haven't done this yet, is because we needed the right people on board, and we did it. So that's being really led by the commissioners, but I'm a part of that. Hamilton County Council on Alcohol and Other Drugs is a part of that, so the different coalitions. So expect that to be coming. And what I can do, actually, if you serve Hamilton County in any way, I will drop in the chat the link to put your information in as a provider. And that gets vetted by Monica Greer from the Hamilton County Council on Alcohol and Other Drugs, but it's not like it's a big vetting process. Like, are you legit? Is pretty much it. And do you serve people in Hamilton County? So I will drop that in the chat so that you guys can click onto that. If there's any like breakdown in the process, email me and let me know because we were running into some struggles and all of that. In addition, look, I said I had nothing to say and now I'm just talking. In addition, if you live in or around Hamilton County, and the cool part of Navigate Hamilton County is that there will also be navigators. Currently, I am the only one, so I'm going to need some others, please. But what that is if someone goes to the web app and is like, this is all well and good, but I don't even really know what I need, that's when they activate a navigator. So I would like get an alert that says, hey, this person, if you can give them a call, this is what they're inquiring about. I gather some resources together. I call that person and send the information their way. And we need more than just me. So if you're interested in that, email me as well. And I put all my info in the chat. And that's all I think I really have. I think.
Fantastic. Thank you very much. And that said, that brings me to Tim Vermand. And I did not share that he and I are both dealing with wheelchair related issues today. I am I'm currently sitting in the waiting room at National Seating and Mobility while they are working on a 3-hour repair to my wheelchair. So, yay, real fun. Tim, did you get your chair?
Yes, I, I guess this is somewhat relevant to this group because they're delivering it in bits and pieces,
Oh,
trying to avoid tariffs and changes to the Medicaid rules. So when they get a part in, they bring it over and install it.
wow. That's very different from my process.
It's very different from my past process too. Uh, I should recognize that waiting room. I've been there enough.
Yes.
Uh,
All you're seeing is a wall and half a window. So,
yeah, well, if you drive straight north from there, you'll hit our house,
ah,
as you know. But uh, there's a stretch of no road in there too
right.
to navigate. Yeah, this morning was the only time they could bring the latest edition over. Um, so I had to go with it.
Okay. Very good. So, are you able to get around?
Yeah, we're looking at minor adjustments, and it's a manual wheelchair, but it has a power wheel
Oh, yeah.
that's removable and fairly lightweight. And these things are all having teething problems.
Oh, interesting.
So like they mounted the control box upside down and had to take it back and flip it over.
Oh, my goodness. Well, and that's the way that technology, we're meant to trust it, but it can be put on wrong, and then you have all sorts of problems. My own legs, I've lost weight to a point that my legs keep trying to slip off, so I have to be more and more careful about that. Um, yeah,
I've been having that problem with my braces.
yeah. So it's interesting how you don't think about the things that impact people with disabilities that go beyond, your normal things. Tim, do you want to talk about the Methodist? I never get it right. The Methodist Disability Council, is that right?
It's a committee,
Committee. Okay,
and it's United Methodist because there are other kinds of Methodists out there.
that's true.
Um, so we we have learned to be careful in the last year as to how we refer to ourselves. Um, we have been following with great interest the talk about autistic people uh, and what happens next and concerns
Okay.
about that.
There are huge concerns about that, Tim. There's a registry of people with
Yeah.
autism and other disabilities starting, and um, there are a lot of people in our community that are scared between that and the comments of RFK recently about autism. Um,
Yeah, that's
it's a
it.
harrowing time.
Yeah, and
Horrified, scared, pissed.
thank you. I want to encourage everybody to speak up about those things that they're concerned about. Although I do want to remind everybody that we're recording this and that I will post it. But um, I myself said things on Saturday at the 505 or 5051 protest that when I came down from the State House steps, I wondered if I needed to become a fugitive. So, but that's not the world that we should be able to speak our minds and our perceptions of the things that are threatening our community. And we tend to approach disability as individual disabilities instead of as a culture. And that is one thing that I have felt has been an obstacle to ourselves in regards to being able to support one another
Yes.
is then looking beyond those individual disabilities to just the cultural aspect that crosses every other demographic.
And we can take a lesson from the deaf community in that they are talking about culture much more than just people who can't hear.
Right, right. Um, yeah, so is that registry, is that now actually in effect?
I don't
There
know.
are
I think it's being explored.
there are a number of jobs open for people to comb records at, nationally, and so I think that's starting in process. However, I have also heard from people I trust that Indiana's had such a list for a while now, which
Really?
I didn't know.
We kind
Um,
of do. Like physicians are required to report diagnosis, but it's not like deep, detailed, deep dive information about people.
yeah,
So we have a starting place, unfortunately, because I've seen the Indeed posts for these jobs. So Indiana has a starting place, unfortunately, to get more information. But anybody who tells you it's the same thing we're doing, but nationally, that's not correct.
Uh,
thanks, Courtney. That's helpful.
yeah.
Okay.
So I also am chairing the state Methodist committee for people with disabilities and our LGBTQIA plus friends. And Tim's on that committee as well. Um, so we try to, from a church and a spiritual perspective, find our place in advocacy and support. Um, and I think it is important for faith communities to step up for folks who feel threatened and also provide collaboration with other agencies that work for the same goals.
I I hate to say it, but I unfortunately in protest or not in promoting the unconference, one of the groups on Facebook that I was promoting that on was the Special Needs and Disabilities Ministry Leaders.
Oh boy.
And they did not react well to me posting something today, and then that turned into a discussion about gender dysphoria, which me explaining that gender dysphoria had been um, determined to be a physical disability through case law, and that wasn't a decision that was up to me. And that it was determined that way, so it meets the first definition in the ADA of a person with a disability. And even if it hadn't been determined that way by case law, that gender dysphoria is perceived by others as being a disability. And that third definition in the ADA of being someone who's perceived by others as having such an impairment would automatically mean that it falls into one of those two definitions, even without the case law. But the result of that is that I'm no longer apparently able to even communicate on that in that group. So
Well, that just puts you in the same class as me. I got restricted there too a
really,
couple years ago.
okay. So I and they went to the place of let's not make this political. And I'm like, I don't know
Mm.
how you talk about the impact of policy on people with disabilities, an entire culture within our nation that represents over a quarter of our population. And I know that that number is higher than what the CDC says, but it's also, well, sorry, no, that number is higher than what the censuses say. But the CDC recognizes that a quarter of adults live with some form of a disability. So,
Mhm.
Right.
I don't
Which
know how.
page is this?
Oh, it was,
I can send you the link, Beth.
Okay.
yeah, I knew that Tim would react that way because he has told me before about that particular group being, and I mean, you hear it in the name, right? Special needs and
Right.
Yes,
disability,
as soon as you said that, I
like
knew.
like separating that somehow. And like I've always struggled with the special needs terminology, but have to allow space for the fact that it is still the intent behind it is still to identify accommodations and the importance of them. But I always struggle because when it comes down to needs, our needs are the same as every other human being.
Hmm.
It's just how they're met special.
Yeah.
So, um,
There's a wonderful video from oh, I forget who. It's on YouTube. Special needs terminology and how what a she say fraud it is.
right.
My needs aren't special.
So, right, exactly. So, all right. Well, we have 2 minutes left, probably less than that. Um, I am happy to give you guys back a minute and a half of your day if you want. If anybody has anything else that they want to say before we go, please speak up, throw any last minute thoughts or events that we need to know about out there or into the chat. I will copy and paste that and send it out in the next email. I'll get the video posted onto my website eventually. So, and the other, of course, she's gone now, but Crystal mentioned being a lone soldier. And there are several of us on this call I know who um, are one man or one person shops, even with the infrastructure of support groups around us like this. So please continue to rely on each other and allow some grace when communication is slow. So,
Jeremy, I just wanted to add that I am in the Marion County Coalition on Aging,
okay.
um, and we are going to be doing a senior expo on June the 7th. If anybody would like to take part in that and be a vendor, we haven't started registration yet, but it will be in the next few days. But if anybody's interested on attending, we're going to be doing like a cookout and we're hoping to get at least 300 attendees there. We're going to have it at the Marion County Health Department. So if anybody's interested in tabling or vendoring, feel free to send me an email. Happy to get you on our list.
Okay. Um, as always, send me emails about stuff you would like for me to share out with the group, though there are only sometimes 8 to 12 people or more or less. There are 120 different organizations that I'm emailing about these things. Whether or not they're paying attention, I don't know. But um,
Yeah,
thank
and a
you.
lot of times I send that stuff forward to my network. So I have like 235 people. So, and then Monica Greer from Hamilton County Council on Alcohol and Other Drugs sends it forward to her network, which
Oh,
is like
cool.
150 people. So
Very,
yeah, we just keep spreading stuff here.
very cool. Thank you. Um, Before we go, I will ask Kristen, and I think I've asked this before, but any help you could provide in connecting me with other systems of care around the state, I would love.
Yep.
Um,
I am the girl in charge of the email contacts for all of the systems of care around the state. So you asked the right girl.
okay, wonderful. Thank you.
Because DMHA used to be in charge, and then they were like, "You guys want to? We're dropping out," and I'm like, "Okay, I got to do this."
All right. Well, thank you all. Our next meeting will be the fourth Thursday of May. So, um, that will be right after my anniversary, but I should be home. So it'll be good to see all of you. Thank you. Be well. Reach out if you need me.
Bye, everybody. Have a good day.
Bye.